And we are live. Good morning, good afternoon, good evening, depending on where and when you're watching this Facebook Live. This is the voice and the face of Dr. Olabintan, founder, CEO, Living Spring Family Medical Center here in the awesome city of Mansfield, Texas. Yeah, and we're doing another Facebook Live, and we'll be talking with the awesome Miss Tenise Hordge on the topic breastfeeding and how appropriate, because this is Breastfeeding Awareness Month. So I'm glad we were able to kind of get this in. So this is awesome. Thank you for coming. And I'm going to ask you to kindly introduce yourself. Who are you and what do you do?
Yes, ma'am. Well, thank you, Dr. Olabintan. So my name is Tenise Hordge, and I'm an international board certified lactation consultant. I'm the owner of Mother's Magical Milk, and I proudly serve the Southern Dallas-Fort Worth area. I'm also located in Mansfield, Texas, very close to Dr. O.
Yes. And people are wondering, like, how did you get, like, what attracted you to this field? Like, why did you decide to do this?
It's very interesting for me, but also deeply personal. So I think like the flame that ignited the whole my obsession with breast milk and breastfeeding started when my daughter was born at 31 weeks gestation. So she spent about 6 weeks in the NICU. I had very amazing NICU nurses, but unfortunately, I got into a confrontation with one of her pediatric doctors about her care and giving her formula. So, as the doctor rudely explained to me that he had numbers, statistics that he needed to fulfill at the hospital that he worked at, and that he needed to, quote unquote, fatten up my daughter so that he could discharge her. And for my husband and I, we wanted to be included in her care, right? I was at the hospital every day, twice a day at the same time, like clockwork. We felt like we were not included in her care. And the only reason they wanted to give her formula was for caloric intake to fatten her up, not for extra minerals or vitamins or because she needed these calories, just so they could like discharge her and send her home. And that wasn't good enough for me. And so other than that, we had really great lactation support in the hospital. But what I realized was that I was the exception and not the rule as it came to hands-on lactation support, especially for women that look like me. And that wasn't okay.
So you became an advocate too.
I did.
And the the formula could be an augmentation, not because I had a premature child and that was suggested, but breastfeeding was also encouraged.
Yes.
Not in isolation. So
Correct.
I'm glad you leveraged your experience to make better experiences for others who may be in your shoes. So love. And by the way, your t-shirt.
I know, right?
I just got distracted by that. It's a good one. All right. My next question to you is this. What are some of the most common perceived challenges to breastfeeding? Like, for the idea of it is like, whoa, that's not for me because of this. What would you say are the most common challenges that people think are common to breastfeeding and so avoid it altogether?
Yes, excellent question. Hands down, the misconception of low milk supply. So Instagram makes my job extremely hard, extremely difficult. You get these posts of these mothers and families with freezers packed full of milk. So women and families, they come to me and they're like, I'm not making enough, or I don't feel like my baby is getting enough. And my number one question is, why do you feel that way? But perceived low milk supply is the number one reason why people discontinue continuing on with breastfeeding, as well as poor latch or positioning. So then the mama is suffering from sore or hurt nipples. Now, I will like to say, Dr. O, from a standpoint of the Black community, there are significant cultural stigmas that we still need to overcome as it relates to breastfeeding in America. Breastfeeding in the past has been associated with slavery, of course, as well as a distrust for going and seeking medical care, which I'm sure that you experience in your practice as well. Think about the Tuskegee experiment and others, especially just like the history of the OBGYN medical profession. So that also plays a factor in my Black families, particularly because of that fear of seeking help, like, this is not working for me, I'm just going to give up, rather than let me call someone that can help with this situation.
So the lack of support and distrust with the medical field. Also,
Unfortunately,
it makes
yes.
people not want to seek help in matters that matter,
Yes.
including breastfeeding. Okay. Now, what are some factors that influence the family's decision to not breastfeed? You already touched about this. And I want us to highlight this so we can see that these things are overcomable. I guess, for lack of a better
Absolutely.
word, like it doesn't mean because breast milk is it's one of the best things you could give your child. So,
Yeah.
what are some factors that influences a family's decision to breastfeed?
Primarily, I would have to say lack of education, because in general, as a people, we don't know what we don't know, right? So if we were able to catch families prenatally with breastfeeding, prenatal 101 support, education on the benefits of breastfeeding to both mother and child, as well as breastfeeding management, because while I've also been guilty of saying, well, breastfeeding is free, everyone should breastfeed, there's still a time aspect that associated with that. And we know that time is not free. So, really being able to educate and help our families through the management of breastfeeding, I think will make a really big difference in a family's decision to choose to breastfeed or not.
Okay. Now let's talk benefits. You
Yes.
mentioned in your phrase, you said benefits to both mother and child. Now, in the self-care movement, no offense, I believe self-care is important. Sometimes there's it's inconvenient. I don't want to do it. It's going to drain me of more energy. It's already hard to take care of the baby. It's already hard with the long hours. What are the benefits? Let's start with to the mother. We know there's the beneficial to the child, but let's
Yes.
start with the mother because we want to balance the need for self-care with the need also of the child. So let's talk first. What are benefits of breastfeeding to the mother?
They're actually plentiful. So I'm so glad that we have the opportunity to talk about this. So everything that I'm going to say is all science based. So the first thing that I want to note is that breastfed mothers get more sleep at night than formula fed mothers. I mean, literally, you just roll over. Also, in addition, so breastfeeding has been shown to reduce the instances of certain gynecological cancers, specifically cervical cancer, as well as certain breast cancers. Breastfeeding has also shown a 17% reduction in hypertension related deaths and diseases. That is important to women because women, I think it's 50% of women have hypertension, which leads to stroke and or heart attacks. And 56% of Black women have hypertension. So it's really significant for women to breastfeed because the science shows us that there are less instances of certain diseases that are hypertension related later on in life.
Greater bonding with the child too, which is
All of that.
and it helps with the stomach GI function of the baby, like less
Oh,
gas,
yes.
fussiness, so less stress down the line. So it's preventive. Now you mentioned rollover. I want to caution there about sleeping with the baby in the bed. I know that's convenient, but be very, very careful. It's best that babies sleep on their own, usually on the back. But I also see the balance of both, being able to turn over and just breastfeed. But I wanted to caution on that.
I agree. And not necessarily sleeping with the baby, but just being able to,
Turning.
yes, versus getting up, fixing a bottle, measuring. And if you're using powder formula, which is not recommended by the American Pediatrics Academy for children under 2 months old, making sure that that's sterile in the correct way. So
it's more cost effective too.
yes.
All right, let's talk benefits to the baby. And we already talked about them already, but what are the benefits of breastfeeding to the baby, and why should we continue to advocate for more of this for our kids?
Absolutely. So you hit on one. So colostrum, which is the first milk, that's the milk that is available and ready at around the 16th week of pregnancy. So the misconception of my milk hasn't come in is actually incorrect. So colostrum is milk. However, it's more like medicine. It's full of antibodies, and it's so important because it lines, it lines the lining of the child's stomach, which prevents bad bacteria and encourages good bacteria. So in addition, breastfeeding reduces the incidence of otis media or ear infections. It reduces childhood diabetes, obesity in children. It's just plentiful. It's multi-generational effects from breastfeeding.
All right. So for those who are watching, there's so many benefits of breastfeeding. Even the little you can get the first few hours days of after having the baby, the colostrum, give it, save it. I remember doing that for my son because I was like, even if I can't give you all the milk, I want to give you some. Some is better than none.
Yes.
Now, Tenise, I have people who are saying this. Good, this is all fine and dandy, but I'm afraid that my boobs are going to like sag all the way to the floor. I'm not ready for that.
Well, good news. So it's not actually breastfeeding that causes the sagging. The Cooper ligaments is what becomes a little stretched. It's actually pregnancy. So pregnancy is actually what causes the breast to change and maybe be a little less flattering after pregnancy and nursing your child. But at the end of the day, invest in a good bra, get a good brassiere. I mean, the benefits outweigh the not breastfeeding. And I also want to say, encouraging the listeners to at least try. It is exponentially easier to start breastfeeding and maybe decide that it's not for you for whatever reason, discontinue, than to not try in the beginning and then go back and try to.
Okay, so the timing is very, very key. Now,
yes,
and I'm going to ask this question because that's very important. It's good that you're here having this conversation, but someone's watching saying, "But I don't have you when I have the baby." Right? I don't have someone like you who's going to advocate for me, who will help me. How can I advocate for myself during that initial postpartum period? I just had the baby. I want to breastfeed, but they're saying, or it's not, I'm having difficulty and no one seems to have the time to help me. What would you say to that person who's watching?
So unfortunately, this is the reality that we live in, right? So I would love to tell everyone to take a prenatal education class, right? And to have a breastfeeding plan very similar to your birthing plan. But I do realize that that's not everybody's situation. So if that is you, I mean, kudos, and definitely take the time to do that. But being very vocal in your delivery process with your OBGYN, your midwife, and your doula, expressing your interest in breastfeeding so that you can get that first 60 minutes of skin to skin. If it is a C-section, asking your OBGYN if you can have an arm out so that you can have a little bit of skin to skin, and touch baby while they're finishing up with the process, and then having baby go with partner, dad, auntie, uncle, grandma, and having that skin to skin. So knowing your options. You mentioned colostrum harvesting. That is something that I discuss with my clients after the 36th week of pregnancy, because any nipple stimulation can cause uterine contractions that suffer from things like PCOS, high BMIs, gestational diabetes. So having that colostrum collected prior to going into labor after 36 weeks, in case there's any complications or baby's blood sugar is low, there are many options. So definitely explore working with a lactation consultant prenatally, and then expressing your desires to your birth team.
Yeah, so you have to be a very good advocate. And at some point, I'm going to come in here and do a live on how to be a good advocate for yourself with your doctor visits or your healthcare visits and things like that, because you have to know that these things are available to you. And actually, there's been years now, even the ACOG, the Academy of OBGs, they OBGYNs have recommended the skin to skin. Studies have shown that it's very beneficial for both mom and child to have that skin to skin, and encourage breastfeeding during that first hour after.
Correct.
As much as possible, of course. So it is something available to you. You may need to add it sometimes, but it's important. Thank you for having that. My next question to you, Doc, Ms. Tenise, is combination. Well, I want to breastfeed, yes, but I don't want to do it all the time because I have a busy lifestyle. I'm back at work, and on my job, they really it's kind of awkward for me to just hide away and breastfeed. I just want to highlight that that's an option too. But for those who want to do combination breastfeeding, because we've talked about the fact that if you the more you breastfeed, the more the milk is produced. What would you say to that person? Like, I want to do combo. I don't want all the pressure to be on me because I feel a little overwhelmed with being the only source of food for my baby.
It can be overwhelming. Absolutely. I first want to explore why the family wants to do combination feeding. So on one hand, I absolutely see clients with legit low milk supply and want to do formula feeding for whatever reasons that fit in with that family. The caveat to that is the nursing parents who give the baby a bottle of formula after breastfeeding because they want to top the baby off. The cons, or the other side of that, is that it is extremely easy to overfeed a baby from a bottle. It is extremely easy to so now we're overfeeding baby. And then the second part is every time that we're giving the infant a bottle and not at the mother's breast, we're reducing the mother's milk supply. So then the mom is not getting that signal to produce milk. So my recommendation would be for those seeking both combination feeding, work with a lactation consultant. And typically it's like the tip of the iceberg. So the combination feeding is at the top above the water that we can see. And the reasons for why that family wants to combo feed is underneath the water that we don't see. So exploring the factors underneath the water as to why we want to combo feed and working on those issues.
Okay, great. I forgot. We're going to highlight the other benefits of breastfeeding for the moms. Number one, it helps with weight loss. Like you're burning calories when you do that. So it helps with that. It also, if done consistently, can be used as a way of birth control.
Yes. So two things there. So whether you're bringing baby to the breast or, using a pump to express that milk, you're burning anywhere between 200 and 500 calories per session. And then the other part, your cycles, your menses coming back. So for up to 6 months, if you are exclusively breastfeeding, baby has not started solids, then yeah, you are reducing, it's like 99% effective of your menses not returning. So the science and biology behind it all is amazing.
Awesome. Now for few tips I want you to give our viewers. How can one make breastfeeding more convenient?
So I absolutely love this question, and the nerd girl in me is jumping up and down. I am a big advocate about normalizing breastfeeding, and to me, the best way that we can do this. So 70%, I believe, is the number of working moms who at some point were breastfeeding or wanting to breastfeed or whatnot. So making it more convenient for moms, employers creating breastfeeding supportive policies, creating spaces for their employees that are wishing to continue to work a space that is private and clean, and why not make it a little cozy to express their milk for their little one when they're separated. We know that it's the law. The Affordable Cares Act passed in 2010 has allowed for employers, more than 50 employees, to have this space. So break time and space for nursing parents, as well as really having a breastfeeding policy that's supportive. Other businesses can not shun a parent or ask a parent to cover up when they're nursing their child. So the things to make breastfeeding more convenient is to support the mother. To support the mother, you can support the mother in her decision to continue to breastfeed her child, because human milk for human babies is the biological norm.
Awesome. And ask for help.
Yes, I absolutely ask for help. This is not a situation where we are suffering, where we are toughening out our nipples, where we have to bear and grin it. This is not it. I always tell my clients, call me. This is not the time to prove you have an S on your chest. In addition, this is also the time to call on your support system. So nursing can be a little bit time consuming. That doesn't mean that you can't have someone come in and do laundry, right? So put the clothes in the dryer and then leave. Empty the dishwasher and then leave. We always get the folks during the pregnancy timeframe, let me know if you need anything. I do. I need a meal. Thank you. And then you can leave. It's okay to say those things.
Man, I say this a lot. When God is going to send you help, he'll send people, he'll send instructions. But here's the thing. When people ask, what can I do to help? The things that you can delegate, go ahead and do that. You can't delegate breastfeeding unless you're pumping and have someone give. But other things you can do that, so it frees you and allows you to do those things that are very, very important, only you can do. So
yes,
key. Really, really key. Other tips I like to add, in addition for those to make it more convenient. Well, you got to get rest. The baby sleep, try to sleep. Sometimes it feels like you're tired, you don't want to give anything else, but prioritizing is also very important. Now, my next question to you is this, though. People are wondering, it's in a simple format. how can I advocate for more lactation support at the bedside? Like scenario, if you create one and say, what would you say? Like, how would you encourage that patient to ask for help?
So just having the courage to ask for help. I'm not getting this. If you're in the hospital session, scenario and you experience labor and you're not getting the support that you need, asking a different nurse. But again, I can't stress enough that prenatal. So having the conversation with someone prenatally before you give birth, talking to your OBGYN, your midwife, hiring a doula. So there are studies that show, hiring a doula have a significant impact on birth outcomes. So this is significant in the state of Texas because we know that the mortality and morbidity rate in Black women is, it rivals that of a third world country. So hiring a doula to help advocate for you, because we're very vulnerable at the point of birth and we can't necessarily advocate for ourselves. Talking with your partner about your desires to breastfeed. We have these baby showers where we give tons of onesies and bottles and like random things that your child may never use. What if we had baby showers that put in like a little kitty for breastfeeding support, or a doula, or someone to come clean the house postpartum? What if we change the world that way?
That is awesome. That is awesome. That is a very good idea. Thank you so much for sharing that. And I'll make sure we note that too in the comments too for those who watch later on. But thank you so much, Ms. Tenise, for coming. This has been very helpful. I have people who are watching who are like, who's this? Who's this Ms. Tenise Hordge? I would like to connect with her. And she's in Mansfield.
Yes.
How can people connect with you?
Yes. So we are on all the social medias and it's just at Mother's Magical Milk. So Facebook, Instagram, TikTok, Twitter. So please check us out. Again, I proudly serve the Southern DFW area. We are located near downtown Mansfield, one block south of Broad Street. Also, if you are not local, please reach out to your local hospitals, midwives, OBGYN offices, doulas for lactation support and references.
Awesome. I will be sure to share all of these in the session. But thank you so much for coming. This was very, 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 very useful. And I'm glad that we had this discussion.
Wonderful. Thank you for having me. Happy Friday.
Thank you. Happy Friday to you too. Thank you all for watching. Please hashtag live. Hashtag replay if you watch this on replay. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician in the Mansfield or surrounding areas, I am she. Have a good one. Bye. Oh.